Welcome to Sheridan Animal Hospital. Your technician will be with you shortly. Your pet has undergone general anesthesia for a dental today. First, congratulations on taking this much-needed step towards the overall health of your pet. Next, we are going to talk about what you should expect once you get your pet home. Here are some things you should watch for in the next 24 to 48 hours. Your pet is lethargic for more than 24 hours. Your pet vomits after the first 24 hours from surgery. Your pet experiences lack of or loss of appetite. Your pet is unable to have a regular bowel movement or urination after 24 hours. If any of these signs occur, please call the office immediately so we can follow up with the doctor. Your pet will be able to eat tonight around 7 p.m. unless you are directed otherwise. The doctor recommends that you feed about a quarter of your pet's normal amount of food and water tonight. As long as your pet does well, they will be able to return to their normal amount tomorrow. Your pet's mouth will likely be sore, so it is recommended that you feed them softened or canned food for the next 14 days. Dry kibble can be softened by allowing it to soak in warm water. In the next 24 to 48 hours, you may notice that your pet has increased salivation or the saliva has a pink to red tint. This is normal following a dental cleaning and extractions. If your pet had teeth extracted today, they will likely have increased amounts of saliva with blood in it. Watch for excessive bleeding or clots from your pet's mouth. If you notice this, please call the office. Many times, when teeth are extracted, the doctor places sutures over the extraction site to aid in healing and prevent the site from becoming impacted with food. The sutures are usually purple in color and not always easily seen. Don't worry, these sutures are dissolvable and will disappear over the next 4 to 6 weeks. Now that your pet's teeth are clean, you're wondering, what comes next? The doctor recommends that all pets have annual dental cleanings, regardless of age. In fact, the earlier in life they start, the longer they can maintain healthy teeth as well as their overall health. The doctor recommends that you use preventative measures in between dental cleanings to help maintain your pet's teeth. Here are some of the options. Daily brushing or wiping of the teeth. Food or water additives. Dental chews at least 3 to 5 times weekly. Please ask your technician about brushes, toothpaste, additives, or dental chews if you are interested in getting them today. If you have any concerns once you arrive at home with your pet, please do not hesitate to call our office and we will be happy to assist you. Thank you for trusting Sheridan Animal Hospital with the care of your pet.